Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, the topic is what happens to patients with COVID over the long term. We hear from three scientists who are part of the Novel Coronavirus Research Compendium at Johns Hopkins, which is online at ncrc.jhsph.edu. First, Dr. Lauren Pietluck, a research instructor in the Division of Infectious Diseases at Vanderbilt University, discusses a study published in Nature by the Veterans Health Administration assessing the long-term experience of patients with COVID. Next, Dr. Heather McKay, a faculty member in epidemiology at Johns Hopkins, explains a study published in Lancet Psychiatry on neurological and psychiatric outcomes within 6 months of a COVID diagnosis. Finally, Danny Sack, an MD PhD student from Vanderbilt, summarizes a study published in Lancet Child and Adolescent Health in the clinical course of children who have multi-system inflammatory syndrome after COVID infection. Let's listen. Lauren Pietluck, thank you so much for coming back to Public Health on Call to talk this time about the long-term complications of COVID. Tell me about the study you reviewed.
Hey, Josh. I'm really happy to be back. So the study that I reviewed was a massive undertaking. So they evaluated more than 800 outcomes that were potentially related to post-acute sequelae of COVID-19. So this is what we used to call long COVID and is now being referred to as PASC. The study included more than 2 million person years of follow-up using data from the Veteran Health Administration database, which includes more than 1,200 health facilities all across the U.S.
And was it one analysis or did they break it into different parts?
That's a great question. So they look actually at 3 different analyses. Essentially, it's 3 studies built into one paper. So in the first study, they're comparing non-hospitalized people with COVID who survived more than 30 days after their initial diagnosis to other people in the Veterans Health Administration database who did not have COVID over a comparable period of time.
Nice to have a comparison group. What did they find when they did that comparison?
So in that analysis, they found that the people with COVID had a 50% increased risk of death and a 20% increased risk of outpatient encounters following their COVID-19 diagnosis compared to that control group. And the key there is that corresponds to about 9 more deaths per 1,000 people and 33 more outpatient encounters per 1,000 people at 6 months following COVID diagnosis. And they also look at, 800 different outcomes. And they found that, of these, there was an excess burden of a lot of respiratory related disorders, but in addition, some non-respiratory conditions, including sleep-wake disorders, nervous system involvement, musculoskeletal pain, malaise, fatigue, and even some disorders of lipid metabolism that were increased among those people with COVID-19.
Got it. Tell me about the second study.
So in the second study, they're comparing almost 14,000 Veteran Health Administration users who had COVID and were hospitalized in the 5 days before COVID diagnosis up to 30 days after COVID diagnosis and survived at least 30 days following their diagnosis. And they compared this to a group of people who had seasonal influenza and were hospitalized kind of using that same range of 5 days before diagnosis to 30 days after between October 2016 and February 2020.
So here they're comparing pretty sick patients with COVID against pretty sick patients with flu.
Exactly. And they use some methods that I won't necessarily dive into right now to make those groups really as comparable as possible. And similar to the first analysis, they do see that there were increased risk of death and outpatient encounters following COVID-19 for those hospitalized patients compared to the hospitalized flu patients. And in this case, those increased risk of death and outpatient encounters correspond to 29 more deaths per 1,000 people at 6 months, and an excess burden of like 1.5 more outpatient encounters every 30 days for the COVID-19 patients compared to the flu patients. And similarly, they're also finding involvement of multiple organ systems. So an excess burden of respiratory failure, disorders of lipid metabolism, fluid and electrolyte disorders, and then seeing increased use across several medications as well.
So this is an interesting comparison with flu. It finds that being sick with COVID may well be worse over the long term than having been pretty sick with flu.
Exactly. And flu is really a good comparator group there because it's another viral infection. And there have been studies previously looking at flu patients to see what long-term outcomes of the sustained inflammation that's caused by flu is. And we're seeing that in this long-term sequelae of COVID-19 is actually a bit more involved than what we have seen previously with flu.
So tell me about the third analysis in this paper.
Yeah. So in the third analysis, they evaluate risk of a smaller pre-specified set of endpoints that have been more indicative of PASC in the literature. And what they're trying to do here is evaluate a gradient of risk. So they compare 3 different groups with COVID-19. So that's including non-hospitalized people, hospitalized people, and people who are admitted to the ICU, all compared to people without COVID-19.
Got it. And so they're looking for what?
So they're trying to evaluate whether, similar to the previous analyses, whether there are differences in these incident diagnoses, and then also see how that magnitude of association changes between the different kind of severity groups.
Which outcomes are they focused on?
So for here, they look at a quite a bit more specific group of outcomes. So they look at incident diagnoses such as acute coronary disease, arrhythmias, kidney injury, chronic kidney disease, memory problems. And they really focus in more on a group of outcomes that we've seen a lot of papers focus on in terms of long-term outcomes of COVID.
Got it. And the results?
Pretty much what we would expect to find having heard the results from the first 2 sections, in that a lot of these diagnoses were heightened in all COVID-19 groups compared to the comparator group, and that risk increased with severity of initial infection.
So we have 3 different analyses in this paper, all of which with different kinds of control groups, all of which finding that there are serious long-term complications that are more likely with COVID-19.
Yeah, exactly. And I was pretty impressed with the paper as a whole. They do a really good job of addressing, potential biases that could have occurred by using their control groups and adjusting for confounding. But I think the findings really highlight a substantial burden of clinical abnormalities that span multiple organ systems that aren't just pulmonary, and that are of differing severity depending on the severity of the initial COVID-19 infection.
Got it. Thanks so much for joining me today.
Yeah, of course. Thank you for having me.
Heather McKay, thank you so much for joining us at Public Health on Call. And you're going to talk about a study about the neurologic and psychiatric outcomes of COVID infection. I'm eager to hear about it.
Yes, thank you. Thank you so much for having me. Right. So the study that I looked into is one that looked at negative neurological and psychiatric outcomes that occurred within 6 months after a COVID-19 diagnosis. So specifically, they looked at 14 different outcomes. So the neurological outcomes included things like cerebrovascular events such as stroke, Parkinson's disease, dementia, some neuromuscular or nerve disorders. And then the psychiatric outcomes that they looked at included anxiety and some mood disorders. They also looked at psychosis and substance use disorder.
So how did the researchers go about evaluating the long-term effects of COVID on these different conditions?
Right. So they first started out by looking at a large network of electronic health records data from 62 different healthcare organizations, primarily around the United States. And they just looked at these data to see how common these sequelae were among those people who had been diagnosed with COVID-19 from between January 20th 2020 up until December 13th, 2020.
So what were the more common diagnoses?
So that's actually a really interesting question. So in the whole cohort of COVID-19 patients, so these are all people who received a diagnosis of COVID-19 in this particular network, they found that about 1/3 or 33.6% received a diagnosis of any negative neurological or psychiatric outcome within 6 months after their COVID diagnosis. And of those, almost 13% of them received a first diagnosis of one of those outcomes. And so the most common outcomes were anxiety, that was about 18%, mood disorders, as well as substance use disorders, which is similar to what another large study found when they looked at these types of outcomes up to 3 months after the COVID diagnosis.
Now, this first analysis that you're talking about didn't have a comparison group. Is that right?
So that takes us to our second aim of this study. So in the second aim of this study, they compared the risks of these outcomes to 2 control groups, actually, which they constructed from this network of electronic medical records. And the first control group included people who had had a diagnosis of influenza during the same time period. And the second control group included people who had received a diagnosis of any respiratory tract infection, including influenza. And
so here we're going to find out whether COVID-19 is more likely to lead to these kinds of challenges after the fact than these other diseases, including influenza.
Right, exactly. So by making this comparison, we are putting these estimates of incidence that we obtained during the first aim into some context, right? So the investigators then looked at the risk of these outcomes among those who had COVID-19 and compared them to those who had influenza or any respiratory tract infection during the same time period.
Very interesting. And now I want to know what happened.
So after they did the comparison with the control groups, overall, patients who had had COVID-19 had a 44% greater risk of having any neurological or psychiatric outcome and a 78% greater risk of having a first adverse outcome within 6 months of their diagnosis compared to those who had had influenza during the time period.
So that's a much greater risk for patients with COVID.
It is. And then they also looked at the risks according to the severity of their COVID-19. And so a notable thing that they found was that the incidence and the relative risk of these outcomes were elevated even among those who did not require hospitalization for COVID-19 compared to influenza. So they made the comparison between those who had the mildest form of COVID-19 with similar patients who had milder forms of influenza. Specifically, the risk for any diagnosis was 40% greater, and the risk for a first diagnosis was nearly 83% higher for those with mild COVID.
And what about for the patients who got much sicker with COVID?
Right. So there was definitely an increasing trend in these risks by category of COVID-19 severity. So those who were hospitalized with COVID experienced significantly greater rates for all of the adverse outcomes compared to those who were not hospitalized. And those admitted to an ICU or even exhibiting delirium, the most severe category, exhibited significantly higher risks compared to those who did not experience those levels of severity.
So again, indicating that there might be something unique to COVID-19 beyond just the trauma of being hospitalized.
Right, exactly. And one of the interesting things that they also did was they looked to see if these risks were constant over time. And they found that the risks for most of the neurological outcomes were fairly constant over the 6-month time period. In contrast with the common psychiatric disorders, so for example, mood and anxiety disorders, by 6 months, these showed a weaker relationship with COVID-19 severity. So this might indicate that some of the psychiatric outcomes, particularly mood and anxiety disorders, might partly be a result of the psychological or emotional or mental implications of their diagnosis rather than a direct result of the illness itself.
Very interesting. Heather McKay, thank you so much for coming to the podcast.
Thank you very much.
Danny Sack, welcome to Public Health on Call. Tell me about the paper that you looked into this week.
Great. Thanks, Josh. And thank you so much for having me. I looked into a paper that did a really detailed analysis of 6-month outcomes in 46 children at one hospital in London, in the UK, who developed a post-COVID inflammatory syndrome.
I've been reading about this syndrome. What's the technical name for it?
Yeah, so it's a little dependent on where you are. This study called it pediatric inflammatory multisystem syndrome temporally associated with SARS-CoV-2, or PIMS-TS, which is quite a mouthful. In the US, it's often referred to as multisystem inflammatory syndrome in children, or MIS-C.
Right. This is much feared because the idea is a child could have a pretty mild case of COVID, but get quite ill a few weeks later. And there have even been some deaths.
Exactly. And the idea is that a child will present with COVID, perhaps asymptomatically. And then, as you said, a few weeks later, present with symptoms, including fever, markers of inflammation in their blood, and often organ dysfunction, which is very scary for both the child and their parents and their healthcare providers.
Got it. So this paper, they took a whole bunch of kids who had this very serious syndrome and looked what happened to them. So what happened to them?
Exactly. So they actually had a multidisciplinary clinic to follow these children. And so they started with baseline measurements of inflammatory markers in the blood, as well as imaging to look at various organs, including their heart, their lungs, their abdomen. And fortunately, none of these children died at the 6-month follow-up. Granted, this is a population of 46 children. And more reassuringly, a lot of these organ dysfunction symptoms and inflammatory markers by 6 months were completely resolved. Unfortunately, there were some functional assessments that they did, including a 6-minute walk test and measures of kids' emotional well-being that were still impacted at 6 months.
So it looked like some of the major problems had resolved, but there could be some lingering effects.
Exactly. So the organ dysfunction seemed to be much improved, but the kind of mental status and psychological health seemed to be impacted. Particularly, they did an assessment of disability at 6 months and found that the children that had developed this inflammatory syndrome reported fairly high levels of impairment in their emotional status, as well as their psychosocial health.
I mean, it makes you wonder whether that was a function of just being so sick and not particularly the virus itself. Did they explore that? Did they explore that in the paper?
Exactly. And that's one of the limitations that they noted. I'm more familiar with the adult literature on this, but in adult patients who do spend time in the intensive care unit, they are prone to having cognitive dysfunction in the aftermath. And so they weren't able to tease out whether this was a post-COVID inflammatory system response or if this was response to spending time in intensive care, as well as all the other changes that happened during COVID, including decreased time with school, decreased social activities, etc.
Well, I am a pediatrician, and I know that hospitalization can be very difficult for kids, and it does take quite a while for kids to respond, and it's also very difficult for parents when their kids are so sick. So I think that does sound like an important area for further work. Thanks so much for joining today.
Thank you so much for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.